Good afternoon, Ajahn and everyone. My thesis, my project is a systematic review and meta-analysis of maternal cirrhosis in preterm labor. My name is Rosalyn Kupwiwat, and my corresponding author or my advisor is Assistant Professor Panlok Chakwitamrong. So, cirrhosis is an inflammatory mediated genetics disease that exhibit in skin and joints, and also affect people, like millions of people worldwide. The global prevalence of cirrhosis can ranges from 0.09 to 5.1%, which can be vary in different ethnic backgrounds. The cirrhosis is characterized by symmetrically distributed, well demarcated erythematous scaly plaque, and also the typical Series scale. It can affect like any sites of the body, including the scalp, elbows, and knees. The pathophysiology of cirrhosis involves both innate and adaptive immune system, and several studies have supported the evidence of interactions between like dendritic cells, T cells, keratinocytes, and other cytokines, especially the IL-17 and IL-23. About half of the patients with cirrhosis are women, and the peak age of onset is observed at the age before 40 years old, which is considered a reproductive age. And there's a lot of conflicting data around the world. And according to the previous study, Bobotsats and the team in 2016, they conduct a systematic review, including 9 observational studies, and they show a significant increase in the risk of pregnancy negative outcomes, including like cesarean delivery, low birth weight, abortion, and preterm labor. But however, like these outcomes were not consistent across the study. So there were no concrete evidence of the consistency of the increased risk of adverse pregnancy outcome for women with cirrhosis. So the objective of the study is to evaluate the association of maternal cirrhosis and preterm labor compared with those non-disease control. As for the inclusion criteria, all published observational studies, including cross-sectional, case control, and cohort and clinical trials, were included. Others, such as case report and observational study without any control group, were excluded. Language was strict to English, and there were no restriction on age, profession, or socio-economic status. As for the search methods, we used the Web of Science, PubMed, Scopus, and Cochrane Library. And we were used by 2 independent researchers, and research studying right from the beginning to May 2020. As for the selection of the study, after we included all the studies, after removing all the duplicates, and we start carefully selected according to the inclusion criteria. And we have the 3rd reviewer to provide the final decision. And the selection process is shown in this flowchart according to the PRISMA guideline. And for the data extraction, we used a standardized data collection form like this. As for the quality assessment, the Newcastle-Ottawa scale was used for assessment of the quality of non-randomized control trial, including case control and cohort studies. As for the data analysis, we measured the associations of the interest based on odds ratios, and the random effects model were used to estimate the pool odds ratios and also the 95 confidence intervals. Study for the heterogeneity was assessed using Q-test and I-squared statistic. And also after grouping the studies by severity and presence of psoriatic arthritis, the sensitivity analysis was performed for preterm birth. And all analysis was performed using Review Manager. And here's all the result and discussion. Here's the table showing the characteristic of the included study. So we had 17 of the included study, and 4 of them is a prospective design, and no randomized control trial available, and 3 articles included exclusively women with psoriatic arthritis. And analysis was carried out on a total of 44,249 pregnancies in women with cirrhosis and a control group of 47 million pregnancy in women without the disease. The 10 study reported on the incidence of preterm labor. The results suggest that neonates born from women with cirrhosis had significantly higher risk of prematurity than those from non-cirrhotic mother. As you can see here, the odds ratio is 1.28 and the p-value is less than 0.00001. And also, when we do the subgroup analysis, there is no significant, statistically significant result for mild cirrhosis and moderate to severe cirrhosis. But in those groups with psoriatic arthritis, we see a significant result that psoriatic arthritis is highly related to preterm labor. As for other fetal complications, such as spontaneous abortion, stillbirth, fetal death, premature rupture of membranes, low birth weight, small gestational age, like anomaly, and NAPGAR score less than 7, these are all insignificant. So our meta-analysis confirmed that cirrhosis could consider as a risk factor for preterm birth. And to the best of our knowledge, this is the first, the largest meta-analysis so far available. And there are several studies suggested that the role of IL-17 in correlation with the significant outcomes that I mentioned. There is a deficit in regulatory T cell in pregnancy complicated by preterm delivery, which support the expression of T helper 17 as of these journal. So our result from this meta-analysis can be explained by the increased level of IL-17 in psoriatic mother, which influence higher risk of preterm labor. And the limitations of the study is the quality of the included study, because all are non-observational studies, because the exposure of interest cannot be randomized, and also the heterogeneity among the studies. So in conclusion, our meta-analysis found an increased risk of preterm delivery among women with cirrhosis when compared with non-disease control. And we hypothesized that this correlation between preterm labor and cirrhosis might be due to the expression of increased IL-17 in mother with cirrhosis. However, further research are essential to get more depth knowledge about the association between the disease and the complications. Thank you.
Thank you. So any comments from the participants?
Me again. Okay. I don't know whether this kind of phenomenon occurs in other in the autoimmune disease like SLE or rheumatoid arthritis. Do they have the high incidence of abortion or the negative pregnancy, as you mentioned?
Yes, Kazan. There are some literature and also I remember there are some systematic review and meta-analysis regarding to these autoimmune diseases, such as especially SLE and rheumatoid arthritis, of course. And it has been proved that it can affect pregnancy outcomes, like preterm labor, and also, if I'm not wrong, pregnancy-related hypertension, such kind. But there has never been any published literature regarding to maternal cirrhosis and the outcomes.
Yeah. As you mentioned about IL-17, I think that's interesting because IL-20 can be found in chronic inflammation. Yes, right. But I don't know how does it work. There should be some other mechanism to to modify this other than say IL-17. That's to my knowledge. Yeah.
Thank you.
And you also mentioned about the psoriatic arthritis.
Yes.
Yeah. This is the. I mean, I don't know whether this is the severe degree of the psoriasis or not, because for this group will have more tendency to be
As I discussed,
negative pregnancy, right?
yes, Kazan. As I discussed with the experts, psoriatic arthritis is a form of cirrhosis that like spread systematically. So normally cirrhosis is affect like skin and nails and stuff, but sometimes in some cases they can also affect joints, which means that the inflammation response like it's all over systematically. So we believe that it might be the cause that like systematic inflammation can increase all these cytokines, for instance, IL-17, and thus leads to this negative outcomes.
Okay, thank you.
So in the obstetrician, they have any management to prevent this?
Not really a prevention, but there's a published guideline regarding to cirrhosis women who get pregnant, but it's mostly about how to treat like the treatments, the medication that we can use. But I think just the importance of this systematic review can raise more concern to the public and also the OBGYN doctors and also the patients to try to at least minimize the symptoms, minimizing the inflammation in the body before getting pregnant. So it can lead to maybe a prevention of negative pregnancy outcomes.
Okay.
Okay, thank you very much.